Unicef Executive Director, Ms. Veneman, has announced a $5 million incentive package aimed at rescuing the ailing Zimbabwean health sector. Speaking at the end of her 2-day visit to Zimbabwe, Ms. Veneman highlighted the need for major stakeholders to put children at the forefront of their collective agenda.
I've had several meetings with stakeholders, members of the government, ministers, President Mugabe, as well as many other stakeholders, members of the donor community, members of the NGO community. So it's been a most interesting trip and one that has informed me in terms of the situation here in Zimbabwe.
The visit by Ms. Veneman, the first by a head of a UN agency in 3 years, comes at a time when Zimbabwe is faced by an unprecedented cholera outbreak, which has claimed more than 2,000 lives over the last 4 months, and a heightened humanitarian crisis, which has seen the collapse of the health and education sectors in the country. During her visit, Ms. Veneman visited the Budariro Cholera Treatment Center, one of 70 set up in response to the raging outbreak.
He started to have a running tummy at 6 a.m. on Tuesday. At that time, I thought it was just a running tummy, but it went on throughout the evening. And late in the evening, one of my daughters called me and told me that he was getting serious. His eyes were turning in and he was appearing very weak. That is when I rushed with him to Unicef-directeur Veneman. An ambulance was immediately called because he was passing out diarrhea a lot. We were rushed to Budariro, where the treatment center for cholera is.
Zimbabwe's cholera outbreak has been aggravated by failing social services in Zimbabwe. Through the supply of clean water to suburbs, support to cholera treatment centers, and provision of water purification tablets, UNICEF has worked at ensuring a minimal loss of life to a disease which is not only preventable, but curable.
While the situation seems to be improving somewhat, at least in the center we visited, there still is not control of this epidemic. And we understand that in rural areas it continues to progress, and so much more needs to be done to address cholera.
Ms. Veneman also visited an orphan care project in Mavuka. The project was set up as a catch-up learning facility for orphans who have not enrolled in formal schools. In the face of mounting problems in Zimbabwe, orphan vulnerability has increased in the areas of food security, school attendance, and healthcare. Under the program of support in Zimbabwe, UNICEF is supporting over 250,000 Zimbabwean orphans to meet their health, educational, and medical requirements. As Zimbabwe's social and economic decline continues, UNICEF has committed itself to helping heal an ailing system. This is Guy Hubbard reporting for UNICEF Television.